The Royal College of General Practitioners every year look at areas of healthcare which may be neglected or may need more emphasis or may need a greater scrutiny over. And I'm absolutely delighted that they've chosen eye health as their clinical priority for the year 2013 to 2016. The aim of this programme is primarily to raise awareness amongst general practitioners. We feel that by raising awareness of eye health problems, that better care will be afforded by general practitioners to their patients, and this will in turn have a knock-on effect in secondary care, in tertiary care and in the voluntary care settings. We hope through this clinical priority to be able to diagnose sight loss at an earlier stage, and this will undoubtedly lead to greater independence and satisfaction amongst our patients. We hope for our patients to live a fuller and independent life for as long and as much as possible, and my hope is that this clinical priority will go some way to meeting that objective. The Royal College of General Practitioners clinical priority has a focus on ageing in sight loss, and there is a reason for that. We do know that 80% of sight loss occurs in patients over the age of 60, so it makes sense to focus on this particular cohort of patients preferentially. In the new NHS, led by clinical commissioning groups, I think awareness of eye problems amongst GPs will be very valuable in bringing about better commissioning of services that are relevant and appropriate for the needs of eye care patients. And this can only be brought about as a result of heightened awareness and knowledge and insight into the specific needs of our patients. Studies have shown that the relationship between the GPs and their patients is a very trusted one, and patients usually trust the GPs above any other healthcare professional. Therefore, we would like to leverage this relationship to allow GPs to be able to advise patients on the best way to detect sight loss. For example, one simple way would be to advise the patients to see their optometrist for an up-to-date sight test, and this may well pick up avoidable sight loss at an earlier stage. The next step in the programme is to develop the other limbs that we have planned. One limb is to develop the e-learning module, where general practitioners will be able to go online and do a series of modules on eye care, thereby increasing their awareness and knowledge of eye care problems. Another limb is to develop a federation of general practitioners across the country. These are GPs who are connected, who have an interest in eye care, where we can share knowledge and experiences and best practice. And by having local champions in eye care across the country, we hope that this federation will bring about a greater level of eye care for our patients. The clinical priority affords an amazing opportunity for healthcare professionals to work together, and I really hope that optometrists will be able to engage with the clinical priority and get involved. I'm hoping to be able to work closely with optometrists to develop innovative and creative ways of delivering care, hopefully developing new models of care that benefit our patients in the long run.